Today, it's a pleasure to invite Dr. Sonja Leonhard, research and PhD candidate at the Department of Neurology at Erasmus University Medical Center, to talk a little bit about the so-called IGOS project, an international cohort project that was designed to study Guillain-Barré syndrome worldwide. So it's a pleasure to have her here and to talk a little bit about this project and how it can contribute to foster knowledge about Guillain-Barré syndrome in the world. So thanks, Dr. Sonja, for accepting the invitation. And I'm going to start to ask you a couple of questions.
Yeah, thank you for having me. It's a pleasure.
Thank you. So, Dr. Sonja, what is the IGOS project and what IGOS stands for, and when was it started?
So, IGOS stands for the International GBS Outcomes Study, and it was started in 2012 by Professor Dr. Bart Jacobs at Erasmus MC. And the aim of the study is that, as the viewers may know, Guillain-Barré syndrome is quite a rare disease, occurring in about 1 to 2 people per 100,000 patients or people. So it's difficult to have a large cohort of patients when you're doing just a one center study or even a multi-center study within one country. That it takes years to have more than 100 patients, for instance. On the other hand, we know that Guillain-Barré syndrome can be very different between patients. So some patients become completely paralyzed and have to be admitted to the ICU to be mechanically ventilated, but other patients, they are able to walk at the height of their disease. And also we know that although some patients completely recover within 6 months, other patients are still wheelchair bound 1 year after the start of the disease. So to better understand these differences between patients and also the differences between outcomes, it's necessary to start a multinational study so that we are able to include enough patients to really answer these questions. Also to study differences between GBS patients across the world. So for instance, is a GBS patient in the Netherlands similar to a GBS patient in Japan or the United States or Brazil? And so that's the reason why IGOS was started. And it was actually quite successful from the start. So at this point, there are almost 2,000 patients included from more than 150 centers across 20 countries across the world.
And I think you already answered part of it. So who designed it and what were the different branches of the IGOS project?
Yeah, so Professor Dr. Bart Jacobs designed the study and the different branches. So there's one protocol, but well, the aim was from the start that the IGOS consortium would be very much involved also in the analysis of the data and in thinking of what kind of research questions can be answered with the data that we gathered. So within IGOS, there are several expertise groups and researchers that are part of the IGOS consortium can join such expertise groups to think of different research questions that we can answer and how we can do that best. So for instance, there's an electrophysiology expertise group, and there is a biobank expertise group, and there's an outcome measures expertise group. So these are groups of researchers within the IGOS consortium that are thinking of these research questions and the analyses of the data for these specific topics.
And had the opportunity to meet you here in Brazil and also at the peripheral neuropathy meeting and in other instances. But which countries have you visited during your research activities?
Well, several countries. So the aim of my specific research was, so when the Zika virus outbreak occurred, an increase in incidence of GBS was seen in countries that were affected by the epidemic. the European Union gave several fundings for research groups to study Zika virus. And then we were asked at Erasmus to study specifically the relation between Zika virus and Guillain-Barré syndrome. Because of our, big network, we were able to quickly start up such a project in an international scale. But unfortunately, Brazil was not yet part of the IGOS consortium. So one of the first things I did during my PhD was to go to Brazil and to talk to neurologists and to see how we can start up a study on Guillain-Barré syndrome in relation to Zika in several cities across Brazil. So that's also how we met in Fortaleza. And so I've been to several parts of Brazil, but then also I've been to Mexico for a conference and to meet up with neurologists there. I've been to Cuba for a conference and the United States, also to several European countries, UK, Italy, Spain. Let me think of if there was Belgium. I've been to Colombia also, but the main country that I visited quite frequently and also actively collaborated with a lot of neurologists was Brazil.
Already talked then. And what was your role in the IGOS project?
Yeah, so as I already mentioned a bit, my specific aim was to study the relation between Zika virus and Guillain-Barré syndrome. So what we did was, IGOS is a cohort study, but not a case control study, and to study a relation between a possible causation between a pathogen and a disease, you really need a case control design. So we made sort of a case control version of the IGOS and also added specific questions and biomaterial collection in relation to Zika virus and also other arboviruses such as chikungunya and dengue. And we started that project across different cities in Brazil and also in Argentina and Malaysia. So that was one of my main projects within IGOS. And also more generally, I've been involved in studying the relation between other infections and GBS as well. So as I mentioned, we have a large cohort of patients, almost 2,000. And of the first 1,000 patients, we have biosamples collected and at our biobank in Erasmus MC. And we tested these samples for the 5 pathogens most commonly related to GBS. And so I've, for instance, been involved in studying these different infections in relation to GBS. So how often do they occur? In what countries do they mostly occur? And also, is there a difference in, for instance, the clinical phenotype of GBS or the outcome of GBS, depending on what kind of infection patients have had? Because, for instance, we know that the bacterium Campylobacter jejuni, which causes diarrhea, is related to a pure motor axonal variant and quite a severe outcome of GBS, whereas virus infections are usually related to more sensory motor, the myelinating variant of GBS. So those kind of questions are also one of my main topics within IGOS.
And what were the best lessons and the best aspects of your research activities at these different countries?
Yeah, that's a really good question. I think that when I started, when I first came to Brazil, I was very new to research in general and new to the IGOS project as well. And also new to Brazil, and I did study the language a bit to be able to communicate with people, although a lot of people, of course, are very good at English. But what I noticed is that there's quite a big difference also in culture. So, for instance, when we have an international guest in the Netherlands, usually you maybe have a coffee and then have a 1-hour meeting and then you go on with your daily activities. But in Brazil, people usually take the time to take you out to lunch and to show you some sights in the city. And they're very hospitable and very proud also of their country. And I think that was quite an eye-opener, because I think that in the Netherlands and maybe maybe in a lot of countries across Europe, we're quite efficient when it comes to work, which can be nice, but which can also be, I don't know how to put it. It also really enriched my experience in Brazil, that people were so hospitable and so eager to show the country, and it really taught me a lot about how you can collaborate in different ways, and that it's not just about sort of efficiency, but also about creating a bond and a mutual confidence in each other and in the relation that you create, which I think is quite important, and maybe something that sometimes people don't pay enough attention to.
And what were the main differences in the management, in the care, and the epidemiology you could observe during your visits?
Well, one of the things that struck me when visiting Brazil is that it really depended which hospital I visited, how the care was organized. And so, for instance, in the same city, you would visit one hospital, and in the emergency room, in the hallways, people would be lying in beds because there was no space to have them in the emergency room, or to have them transported to the clinics. And in another hospital, it would be just very clean and very new and very maybe a bit more similar to here in Erasmus. And I didn't always understand why there were such big differences. And part of that was the difference between private and public healthcare. So in the Netherlands, you do not have really private healthcare. Maybe for some, plastic surgery or something like that. But for sort of the general medical care, you only have public health care. And in Brazil, it's separated. So you can go to the private clinic when you have enough money, and when you don't have enough money, you go to the public health care. Well, very basically, I mean, maybe always like that. But so you really did see also quite big differences in the way it was organized, and the amount of facilities and the quality of the facilities between these different hospitals. And I think that was, for me, not being familiar with that type of organization. It was, it taught me a lot about sort of the differences and what it can cause, because I do understand that there can be benefits from having a difference between private and public healthcare, but I think one of the things that it might cause is that the public healthcare is not, if it's not funded enough by the government, people don't get the quality of care that they really need.
And when IGOS is going to stop, or is it going to stop, and when the last patient will be enrolled?
Yeah, that's a good question. It's something that we're still debating. Originally, the plan was for IGOS to have 1,000 patients included and then stop. But because back then, I'm not sure exactly what year that was, but maybe 2015 or something, the inclusion rate was going so well, and a lot of countries were interested to participate that had not participated before. So it seemed foolish to stop at that point. And the idea was to at least have, next to the 1,000 cohort, have another 1,000 patients as a sort of derivation cohort to compare your results. And now we're almost up to that point that we have 2,000 patients included. So I think we are up to 1,966 or something like that. So by the time the next Peripheral Nerve Society meeting is, probably in July, we expect to have the 2,000 included patients, which was our next goal. So then the question is, what's the next step? I think that we are quite eager to keep collaborating with all the researchers that want to keep collaborating with us, and we want to uphold the network. But we also want to critically think about what are the questions that we think should be answered in the field of GBS, and how can we best do that with the protocol that we have and the network that we have. So probably is going to be like a sort of IGOS 2.0, where we will adapt the protocol to really be able to answer questions that we cannot answer yet with the current protocol.
And what do you consider the most important collaborative research lesson you have learned and could share with the audience?
Yeah, so I think I mentioned already a little bit before, but I think that's one of the things I learned is that there are quite different ways culturally also of collaboration, of what people find important in collaboration. So I think that in Brazil, there is much more of a personal connection involved in collaborative research, and maybe a bit less efficient sometimes. But I think that one of the main lessons that I learned is that you can learn a lot from these different ways of collaborating, and that it makes your work a lot more enjoyable if you're open to that, and if you are able to think also critically about the way that you are used to collaborating, and perhaps can improve that with sort of the things that you see that are different in other cultures. So I now, when we have an international guest, go out of my way to sort of have lunch with them and show them around, etc., because I really enjoyed that a lot and thought it was also really important for future work, because you have sort of a personal connection with somebody, and it makes it a lot more easy to trust each other in future collaboration, which I think is one of the key points in collaboration, that you trust each other and that you have an enjoyable connection, not only sort of the content of your work, but also on a personal level.
And so you're finishing your PhD. What was the specific topic of your ongoing research efforts, and what do you consider the main findings?
If I have to put it into sort of one sentence, I think that the main research question was the relation between GBS and preceding infections, and then specifically arbovirus infections such as Zika virus, but also other infections related to GBS, and also how GBS can be affected by epidemics or pandemics of infectious diseases. So, for instance, what we saw during the Zika virus epidemic is that there was an increase in GBS patients, and that this also caused problems for clinicians taking care of these patients in terms of availability of facilities to take care of them, such as ICU beds, etc. And also that what we see now, for instance, with the coronavirus, is that, again, there are case reports and case series published of patients with GBS who've recently had coronavirus. And I think that's one of the things that I try to get more clear with my research is how you can best study such a possible relation during an epidemic. So I think those are the main topics of my PhD, and I think the main lessons are that networks are very important. So because you don't know when the next pandemic is going to occur, but what you can do is have a stable network that you can easily that allows you to easily start a new research project. So because you already have the context, you already have the protocol ready, so you can start immediately. Because what we saw during Zika is that even though we had the network ready, we weren't really ready enough to sort of start quickly. So it still took us, I think, almost half a year before we could include the first patient in the study after sort of starting it up. And I think that now, with the lessons that we've learned from the previous pandemic, we we can use them in now studying, for instance, the relation between GBS and coronavirus. And yeah, I think one other important lesson is that we did also together with you, we did a survey amongst neurologists that were part of the Neurology Association in Brazil, to ask them what the limitations were in the treatment and the diagnosis of GBS. So, for instance, some of the main limitations were the availability of electrophysiological diagnostics and beds in the ICU. And we also used this information to write clinical guidelines for GBS, because when the Zika virus epidemic started, there were no international clinical guidelines for GBS. So some countries had national guidelines, some hospitals had hospital guidelines, but there were no really international guidelines. So our hope is that now, when there will be a new pandemic that causes an increase in GBS cases, clinicians will be better equipped with sort of knowing what to do on different occasions in GBS patients.
Yeah, that was even one of my questions, next questions. So how were the research activities affected by the COVID-19 epidemics? And how do you think it's going to impact research and collaborative research worldwide?
Well, I think specifically for the IGOS projects, I mean, the follow-up of patients was more complicated because hospitals were overloaded with corona patients, and unless it was really necessary, people were not seen back at the outpatient clinic. So the standard protocol for IGOS is that the patients are seen back a couple of times at set time points to see how they are doing, so we can monitor the differences in the clinical outcome of GBS. So that was difficult for a lot of clinicians to remain doing this during coronavirus. And also, as I mentioned, there were some case reports and case series of GBS patients that got ill with GBS shortly after having had coronavirus. And so it was suggested, well, perhaps coronavirus is one of the infections that are able to trigger GBS. And we were able to study this within IGOS. So we looked at all the patients that were included in the first 3 months of the pandemic, and to see how often they had signs of a recent coronavirus infection. But this was not a case control study, of course, so we can't really conclude anything about sort of a causative relation between the two. What we did see is that we did not see an increase in the amount of GBS patients that were included in IGOS, which is different from, for instance, what we saw during the Zika virus pandemic, that you did see a clear increase in the incidence of GBS, and we didn't see that within IGOS, but also not in other surveillance studies. But what we did saw is that quite a high percentage, I can't remember, I think about 30% of patients had evidence of a recent coronavirus that had GBS. So it's something that we still need to look into more carefully. But at this moment, there's not really enough evidence to say anything about there being a causative relation between coronavirus and GBS. And concerning sort of what the coronavirus will have as an effect in general in sort of research collaboration, I think that it has upsides and downsides. So one of the things that make research collaboration more difficult during the coronavirus pandemic is that we cannot visit each other. So we cannot go to conferences, we cannot do site visits. And I think this is really an important part of collaboration, as I mentioned before. It's sort of the personal connection and a level of trust to have among each other. And that's much more difficult to do when you're just on the telephone or when you are emailing than if you're at a conference and you can sort of maybe have a laugh about something as well, or have a drink, or have something to eat. It's a different atmosphere. So I think that's something that in the long run is really is really critical also for research, and it's a shame that we don't have that anymore. On the other hand, what I do see is that everybody is getting much more comfortable with meeting online via different media such as Zoom. And this is also making it more easy to have meetings on an international scale that are successful, because I remember when I just started my PhD, when we were sort of planning a Skype meeting, something would always go wrong. So somebody would not know how to log in or how to turn the camera on, or the connection would be really bad. And I think that's something that now we are all getting sort of professional in sort of how to meet online, which also I think is really good for international research. So I think that there are benefits and there are downsides, but hopefully, within 1 or 2 years, when we'll be able to meet again in person, we will eventually go out of this pandemic with sort of the upside that we are able to communicate more easily online.
The main goals of the channel is to foster like collaborative research and talk about science and science experience. So what are your final words for the audience?
What are my final words for the audience? I think that it's important to, in research and in collaboration, to also have fun and to enjoy yourself. And I think that's something that I think the shared love for research and to really understand something, understand the disease, understand the pathophysiology is something that connects people from all around the world. And I think that focusing on the enjoyable parts of this international research is important in sort of to keep understanding why we're doing this, and to have fun with it as well.
Thank you, Dr. Sonja, and hopefully we enjoyed this meeting.
Definitely, yeah. Thanks a lot for having me. It's an honor.